From the banks of the Swan River to the waterways of Brisbane, the capitals of Australia's two largest states have mostly escaped COVID. It's as if the pandemic has yet to arrive.
As far as everyday life continues semi-normal, it's not the worst.
We've just been to the zoo. It's just carrying on like normal.
If you're just walking around the city and everything, you're going to see what you saw a few years ago, really.
Except for the masks.
Except for the masks.
But there are real costs to remaining isolated from the most populous states of New South Wales and Victoria, especially for families and businesses that cross state borders or rely on interstate trade.
Look, we're down more than 60% across the year, and there's been periods when we've closed the doors.
There's mounting pressure on both the Queensland and West Australian governments to spell out how they plan to open up to Australia, as they face questions about how their health systems will cope with COVID. Do you have a sense of apprehension when those borders eventually are opened?
I think there would be something wrong with us if we didn't have a concern.
I understand that it's a challenge to get a response that everyone likes, but I do think we need to have a plan.
Both Queensland Labor Premier Anastasia Palaszczuk and her West Australian counterpart Mark McGowan clinched strong election victories on their records of keeping their borders closed and their communities mostly COVID-free.
Tomorrow, we get right back to work.
So we can vaccinate as many Gold Coasters as possible.
The path to open borders is through vaccinations, and both Western Australia and Queensland have the lowest vaccination rates in the country.
Well, I think there is a lot of speculation that those are the states that perhaps have the lowest perception of risk because they've been so successful at keeping the virus out.
The Queensland government says one of the main reasons why vaccination rates are lower here than elsewhere is because of supply, and that's a Commonwealth issue. Do they have a point?
Initially, I think they've got a point, but we're now awash with AstraZeneca vaccines. Practices like ours and the state government hubs cannot give AstraZeneca vaccine away.
No, I do not want under 40s to get AstraZeneca. I don't want an 18-year-old in Queensland dying from a clotting illness who, if they got COVID, probably wouldn't die.
Brisbane GP Dr Ian Williams blames comments made by Queensland's Chief Health Officer more than 3 months ago for the state's relatively low take-up of the AstraZeneca vaccine.
It was also because of the inconsistency with the Australian Technical Advisory Group immunisation.
Are you still feeling that now?
We're still feeling that now.
The vaccination rates in both states also vary widely between regions and communities. This pop-up clinic in East Perth is an attempt to protect more vulnerable Indigenous groups.
We know that Aboriginal people will be disproportionately affected from infections. Vaccines prevent hospitalisation and death, but also it means that we can get back to our normal lifestyle and start travelling between communities.
This unevenness in the vaccination rollout is one of the reasons why the Queensland Premier has been reluctant to spell out when the borders will reopen.
We want to ensure that every eligible Queenslander has the opportunity to get the vaccine. We're working out when we would get to 80% double vaccination, but like I said, I want that evenly spread across the state.
COVID has seen a surge in demands on emergency departments across Australia. Queensland's 4 major northern regional hospitals all went into code yellow during one day last week, meaning they were all operating at near capacity. Intensive care specialists say they're as ready as they'll ever be, but it's not going to be easy.
I think people are worried, there's no doubt. People are concerned. There's, deep concern amongst my colleagues, and I think rightfully so. But there has been substantial preparation, a lot of thought, and I would suggest we're probably a lot better off than we would have been if we'd been exposed to those big numbers 18 months ago.
While health workers brace themselves for COVID, many businesses are looking forward to the resumption of interstate trade. Queensland tourist operators are calling on the Premier to give greater clarity about the upcoming Christmas holidays.
I mean, we're not greedy, we'd just like one. I mean, New South Wales or Victoria.
From my point of view, she needs to make a decision either way so that we know where we stand.
While the Queensland Government remains coy about the border reopening, the General Manager of the Paradise Resort on the Gold Coast says it's hard to plan for the future. David Brooke is concerned about how his resort will manage the inevitable introduction of COVID into the community.
The biggest problem is there's no roadmap for us. Can we ban people from coming in because they haven't had a vaccination? Can we enforce our staff to have vaccinations? And I think the whole industry is struggling with that at the moment. In where do we stand? Where's the direction coming from?
One thing everyone agrees on is that the current model of relatively safe isolation can't go on forever.
The trouble is this sort of a strategy can only really be temporary, and in my opinion was designed to get us to a point where we had a safe and effective vaccine that could be rolled out. We now have that.
The word for freedom is vaccination. That's how you spell freedom in Queensland, is vaccination.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.